Have you ever thought about chiropractic care? Have you ever heard about it? And I'm sure that most of you probably have. But have you ever thought about taking your child and taking them in early childhood? Chiropractic care is a minimally invasive procedure that helps relieve many symptoms of diseases and can actually even prevent problems from occurring. Otitis media is the medical terminology for an ear infection. Ear infections are amongst the most common problems among children. An effusion is defined as a buildup of liquid or gas in your ear, and subluxations are actually when your spine, the bones in your spine become misplaced and twisted. Childhood chiropractic care stops recurring ear infections in children. Chiropractic care, a minimally invasive manipulative therapy, proves to be effective, and chiropractic care reduces antibiotics and short-term solutions, and chiropractic care helps soothe colicky babies. First, chiropractic care manipulative therapy proves to be effective. In a case study done by Dewar and Boyson by the Journal of Clinical Chiropractic and Pediatrics, states that with audiology monitoring, which is hearing monitoring, along with chiropractic care, offered children with recurrent ear infections and hearing loss the most possible benefit of recovery from their conditions, and without the concerns of antibiotics and their side effects. In that same study, it states that swollen lymph nodes create muscle spasms, and when your muscles start to spasm, it can actually damage the Eustachian tube that's inside your ear. And when that spasms and it causes damage to the tube, that can create pinched nerves and blood vessels, which causes the buildup of fluid and the buildup of gas. Manipulative therapy is safe. It's hard to get people to do these studies, so there's very few studies that have been done, but it is safe for your children to do this. What is the first thing you do when you get sick? You go to antibiotics. But is antibiotics really the way to go? Second, I'm going to talk about how chiropractic care avoids antibiotics and short-term solutions. According to general practice done at the University of Queensland Graduate School of Medicine, this states that antibiotics create too many effects. There are no long-term solutions for them. Many doctors will advise patients to take them only because they possess short-term benefits. Antibiotics will cause many risks, infections, and prove that you have GI problems, which is in your stomach. It can cause thrush and destruction of your natural flora, can cause allergic reactions, and it can also create microbial resistance, which is creating the bacteria become resistant to that actual antibiotic. In the same study, it showed that the antibiotics did not resolve any pain from the ear infection in the first 24 hours. It did show that it reduced pain by 40% in days 2 through 7, but it did show that it reduced contralateral infections, which means you have an infection on this side, you could get an infection on this. Antibiotics did reduce that, but it had no effect on recurrent antibiotics. So would you give them to your child knowing that it can cause such upsets? Thirdly, I'm going to talk about how chiropractic care soothes colicky babies. When you have that baby that just will not stop crying, what are you going to do to help that baby stop? In a 2010 academic article published by the Journal of Chiropractic and Osteopathy, says that there is good evidence that taking a colicky infant to the chiropractor will result in fewer hours of colic by parents. There is a medication out there, it's called doxycycline. This has shown to reduce colicky, have helped soothe colicky babies by 63%, but the side effects of this medication prove to be much worse than just a crying baby. Side effects of this medication include seizures. It includes apnea, which is when breathing will start and stop. It can actually even cause your baby to go into a coma. So why would you give this medication to your child when you can simply help them get adjusted and get their spine in order? Why would you give them such a medication that can cause such damage to them? So in conclusion, chiropractic care puts nothing into your body and it takes nothing away from your body. It simply allows your body to naturally heal itself. It aligns your spine to allow your nervous system to function to the fullest capacity that it was intended to do this. Modern medicine is okay. Antibiotics work when they are intended. We are handing them out too much. We are creating these superbugs, these bacteria that are resistant to these antibiotics. And what are we doing? We are creating a terrible environment for our children to grow up in. I encourage you, and I will end you on this, I encourage you to take your child to the chiropractor. It has no effect on them whatsoever, and it will not hurt them. Allow their bodies to function in the best way that they can. Little kids are always running around, they're falling down, they're sleeping in funny positions. Their spine is always constantly moving. Allow them to have their spine straight in the way it was supposed to be. Allow their bodies, allow these children to live the best life that you can give them. Because if you can't provide it for them, if you can give them such a simple gift, why not allow them to have a really healthy and happy life?